Hello, everybody. I know this is the off season, but I couldn't stay away, and I have a fantastic interview for you about diabetes stigmas. My interview is with Dr. Jane Speight, a researcher out of Australia whose work has been cited worldwide. In fact, 21% of her publications are among the top 10% cited worldwide. I mean, she's the NBA star. She's the LeBron James of diabetes research. Yes, that's right. The all-star of diabetes research said yes to being on my humble podcast, Type 2 and You with Meg. So I don't care where you fall in the world of diabetes, whether you have diabetes or you care for someone who has diabetes, there is something in this episode for you.
Welcome to Type 2 and You with Meg, a diabetes podcast with the tools and guidance you need for your best life with Type 2 diabetes. Your host, Megan Munoz, is a Dartmouth-trained health coach and master-prepared certified diabetes educator. She's helped thousands of people turn their diabetes fears, questions, and concerns into hope, confidence, and action. Ready to support your Type 2 journey? Here's Meg.
So Dr. Speight, Jane, thank you so much for being on the podcast today to talk about some of your research and your work in diabetes stigmas.
Hi, you're very welcome. I'm glad to be here.
So you are the foundation director of the Australian Centre for Behavioural Research in Diabetes, which was established in 2010 as a partnership for better health between Diabetes Victoria and Deakin University. You have a PhD in health psychology from Royal Holloway, University of London, and you're a chartered psychologist, a fellow of the British Psychological Society, and a fellow of the Royal Society of Medicine. And if that is not substantial enough, you have published a tremendous number of articles, over 160, a couple of books, several book chapters. I've done over 220 conferences, and I read that your research has been cited 118% more than similar publications at the same year of same type and same discipline, and your research has been cited double the world average. That's just tremendous that people have found so much from your work and have used your works so much in their work.
Yeah, I'm very fortunate that people are interested in this topic and taking it seriously.
What else would you like people with type 2 diabetes that are going to listen to this podcast and some healthcare professionals, what else would you like them to know in terms of you and what you do and your work?
I think I'd like them to know that our research centre is very applied. So because we're funded by Diabetes Victoria and we connect in with the other diabetes organisations around Australia, we really take the issue of making sure that our work can translate into outcomes that matter to people with diabetes and their families and the health professionals that support them. We take that all very seriously. So we don't just do research, write a paper and think, oh, that was nice. We really want to make a difference.
When did the attention to diabetes stigmas start? Was that something that happened right from the beginning, or is it something that developed over time?
Yeah, it's a good question, and I was sort of pondering on this before we were, when you sent your questions through to me. When I was growing up, I had a friend who had type 1 diabetes when we were at school. And I remember her being treated quite differently to other children at school. But obviously I didn't know very much about diabetes in those days. During my PhD, I didn't focus on stigma, but I was, acutely aware of my PhD focused mostly on type 1 diabetes. And I was acutely aware of the stigma for people of injections, of glucose monitoring, of having to carry around lots of devices, and this was long before people had smartphones that they just looked at and were attached to, all day long. So there's a lot of stigma for people to have to carry such devices and look at them. People would think that they were, a bit, what are you looking at? What have you got there? So I was aware of that kind of stigma at that point. And And then around that time, or soon after that, a colleague of mine who was also doing her PhD at that time, she was studying the impact of diabetes on quality of life in people from India. And so I became aware of different cultural beliefs and stigmas that people from that subcontinent were experiencing. So, for example, in that part of the world, it can be really difficult for people with diabetes to get married, to form romantic relationships, because people are concerned about diabetes being hereditary and being passed on to children and so on. So, that was really quite eye-opening for me. And all of that was about 20 years ago. But it was really only when I came to Australia that I began to research it. And so we started looking into it, I think, in about 2011. And that came about because of an article that was published in one of the Australian newspapers here that was talking about how we as a society need to be doing more about the obesogenic environment. And that it's not all a matter of individual responsibility. We need to be taking it very seriously as a society, that we don't leave people exposed to an environment in which, fast foods and sugary foods and so on are just so readily available and almost foisted upon people with the amount of advertising and accessibility that there is. And the reason that the stigma came to my attention was because in response to that article, there were a huge number of comments posted online from people in the general public who basically said that people with obesity and people with type 2 diabetes were bringing it on themselves. And they were really very stigmatizing and discriminatory of people with diabetes, saying that they didn't need our help, they didn't need our support. Why should our taxpayer dollars be given to these people who just have no control, who are lazy, and all of these things were just really quite horrible. So it really got us into thinking, was this just a small section of the community who just like posting nasty things online, or is this stigma actually real? And we looked into it, and there really hadn't been very much research at that time. So we did a review of the literature and found that actually there were some studies, but most of the studies were actually looking at the stigma of other conditions like epilepsy, HIV, mental health, and they were including people with diabetes in those studies as the control group, because the researchers themselves thought that diabetes wasn't a stigmatized condition.
Really? That's very fascinating. That's shocking, actually.
Yeah, absolutely. But the people in those studies with diabetes, showed that there was stigma around diabetes. So then that led us to do the first qualitative research, really looking into what people's experiences of stigma were. But we didn't tell people at the time that we were interested in stigma. We just asked them what their experiences, what their social experience of living with diabetes was. How do friends, family, other people experience their diabetes, and what are their relationships with those people like. And over 80% of people actually brought up some form of stigma all by themselves without us using those words. So it really became quite evident to us in over 50 interviews with both people with type 1 and type 2 diabetes that this was an issue, that people were experiencing stigma in their everyday lives because of their diabetes.
So what were some of the common themes of the stigmas that these folks talked about with you guys?
Yeah, so there are several themes really to the stigma that people experience. For some people, it's about being treated differently. For example, being at a party and a gathering of people where food is being offered and not being offered that food because you've got diabetes. So someone trying to be careful with you because they think that they're being sensitive to your needs, but actually that means that they're treating you differently in front of other people. also being treated differently in the sense that people are not offered the same opportunities for like jobs and opportunities for travel and so on, because people think that they're limited in some way because of their diabetes. People are blamed and shamed for their conditions. So, as I've already mentioned, people being considered to blame for getting diabetes in the first place, but also to blame for getting the complications of diabetes. So that also is a big problem in how we view diabetes. Is not only do we sometimes consider that people could have done more to prevent type 2 diabetes, but we also consider that people could have done more in managing their diabetes to prevent their complications. So people are indeed blamed and feel ashamed for getting those complications. And it's only been in the last few years that people with diabetes have really spoken out quite vocally about complications, and certainly in blogs and so on, about how they feel about getting complications, because they've started to feel that this is an issue that needs to be discussed more openly. How many people do other people know that have complications? And it's because people don't really talk about it too much.
And rightly so. I mean, rightly so, if they felt, just kind of like people with the type 2 diabetes diagnosis feeling like they don't really want to tell people or talk to people. I'm sure you've met a number of people that have had that experience, but I know I have as well, but that they don't tell their friends or they don't tell their family members, which makes it harder to manage because they're kind of keeping that diagnosis to themselves. So they're not going to actively make different decisions about or check their blood sugar in front of people or take medicine in front of people if they need to. But you could see how that would play out even in the complications. And I have to say that I'm kind of embarrassed to say this. I didn't blame people for their complications, but it was very eye-opening when I spoke with someone with type 1 not long ago who talked about just the amount of technology and resources that we have available now to manage type 1 and type 2 diabetes compared to 50 years ago when she was diagnosed. And it's so silly. I should have thought about that, but I didn't think about the vast amount of resources that are available compared to people so long ago. So if somebody's lived with diabetes 20, 30 years, some of those complications were just because there were a lack of resources for treating diabetes in general.
Yeah, absolutely. And even now, I mean, we have structured education programs that we know can help people in terms of helping them to understand their condition and how to manage it well. And yet those programs aren't available to everyone with diabetes. They're not offered routinely. And even if they were, there aren't enough of those programs to go around to enable everyone to attend them quickly enough. So this is a big problem. It's not just the technology, it's also the education and the support and the medications as well. People often aren't having the right medications for them at the right time. So there's a lot of different medications that you can have for type 2 diabetes, but it takes a lot of working through to make sure that someone ends up on the right medication and it's really managing their glucose levels as best they can.
Right. I absolutely agree. And I think that brings me to my next question, which these stigmas are, I don't know, maybe it's just my personal opinion. I'd like to know yours, obviously. But it seems that they're underplayed significantly, these stigmas, by the medical world and even our society. And so there's tremendous impact on someone's clinical and mental health with diabetes. So how well their health is related to their options in the clinic and their doctor's treatment and their care, how the doctor's treating them and what their care looks like, and then the mental impact of these stigmas. So am I right along those lines? Is that those stigmas are so deep that it really does impact someone's physical and mental health with diabetes?
Yeah, I think that is likely to be true. We don't really know enough about the impact yet from a research perspective. So, as I say, it was only in the last decade that we've started to research this properly. And so far we've done qualitative studies, we've designed questionnaires, and we're now starting to use those questionnaires to understand the extent of stigma and its impact. And we're looking at associations with other outcomes like emotional well-being, like beliefs about medication, social support, quality of life, and so on. But it's very difficult to, in research, with something as pervasive as stigma, to really isolate what came first, the stigma or the outcome. So, is someone's diabetes distress related to their stigma? Is their stigma related to their diabetes distress? These are difficult relationships to pick apart. So we do know that these things are quite closely related, and there are associations between these outcomes. But logic would suggest that stigma impacts on people's emotional well-being, that it causes some elements of diabetes distress for people, that it lowers people's self-esteem, it raises anxieties in certain areas, and certainly that it would increase feelings of low mood, which may well contribute to depression. So I think in terms of how people feel emotionally, in terms of their mood and their mental health, I think it's reasonably clear why there would be links, and certainly the associations support that. We also know quite a bit about the role that beliefs play in attitudes to treatments and willingness to start insulin. So I think here there is something that is very underestimated, particularly by health professionals, is that the feelings that people have about their diabetes and then about particular treatments will impact on their willingness to use them. And research from our group, led by Dr. Elizabeth Holmes Truscott, has shown that that people feel a sense of failure about going on to insulin. So if people are feeling like going on to insulin means that they've failed in some way, then no one really wants to feel like a failure. So they're going to put that off. They're not going to want to become that thing. So it's really important that we appreciate that when we talk about insulin, that we don't use it as some kind of stick with which to beat people up, that if they don't manage their diabetes better, they'll need to do this, and keep using it as some kind of threat. It's really important that we talk about insulin as being an effective treatment for diabetes, and one that can really help people with diabetes that needs it at a certain point in time. And so, the research that we've got in this area shows that, people who have these feelings of failure and blame associated with insulin are 3 times more likely than other people to be unwilling to start using insulin. And we know that people who are unwilling to start using insulin are 6 times less likely to be managing their diabetes with insulin a year later. So these are really important findings, and these are not just associations, because we do have longitudinal data about these now that show that people's attitudes to their diabetes, the feelings of stigma that they have around their diabetes, do affect their willingness to use certain treatments, and indeed that affects their use of those treatments in the future.
I'm glad you brought that up, because I think one of the things that is stuck in my mind that I will never forget is working with someone who had type 2 diabetes for 20 plus years, had been on insulin for a number of years and struggled getting her blood sugars managed. We worked together a little while, and one time she came back to me and said, I feel guilty every time I take my insulin. I feel like I didn't do enough. And that's why I have to take it. And we had the lab work that showed, her body doesn't make enough insulin anymore. Even though she'd been on insulin for years, she just still couldn't stop blaming herself. And so she would struggle with taking her insulin regularly. And I will never forget her, and I will never forget that. And I think that's probably what prompted me to start looking at more of the research on diabetes stigmas, because I thought, my gosh, what are we doing to people? I get emotional thinking about that. If that's the mentality that we've had, that we've built this ingrained sense of failure in people, that it's so deep that they can't even feel a sense of confidence in using medication when they need it. We're doing something wrong. We need to do something different for sure.
Yeah, absolutely. And, we've had people, tell us that they're, taking their medications, they're exercising, they're doing everything that they can. And they've said to their health professional, I go to the gym twice a week. And the health professional said, that's not enough. You've got to go 5 times a week. And that sense of, not appreciating the efforts that people are making to manage this condition, which is a really difficult condition to manage well, and to fit that into their lives. For a health professional not to really appreciate that and show empathy for that person and the struggle that they have with this, I think is, really quite appalling.
Yes, I would agree tremendously, because it is incredibly challenging, and we're all busy. We all have things to do. So to add on everything that you need to do to manage diabetes and to be expected to do it perfectly is quite unreasonable, in my opinion. Can someone with type 2 diabetes experience the effect of diabetes stigmas without necessarily feeling stigmatized? So, for example, if someone thinner has type 2 diabetes, could they still have could they still struggle with diabetes distress? Could they still experience some of those stigmas that you talked about, where they maybe don't get the same jobs and travel, or I don't know how to word this necessarily, but they themselves don't feel like they were stigmatized against, but they do still get the effect of that just because of how our society works and how we think about diabetes?
Yeah, it's an interesting question. We've certainly spoken with people with type 2 diabetes who are slimmer than average, and so average for people with type 2 diabetes, because we do know that type 2 is associated with overweight. And those people who are slimmer do tell us that people in society are often surprised that they have type 2 diabetes, and they assume that they must have been overweight in the past, even if that hasn't been the case for that person. And that's been quite distressing for those people to have those conversations and to be feeling like others think that they've brought it on themselves in some way. There are, I guess, some positive differences in the healthcare that those people have. I know of a few people who've had type 2 diabetes diagnosed when they've been slimmer, and there was a readiness amongst their health professionals to consider that it might be type 1 diabetes, and not to just make assumptions that it was type 2 diabetes. And conversely, we know of people with type 1 diabetes who are overweight and diagnosed as adults, who have really struggled with getting the right diagnosis because people have just assumed that it was type 2 diabetes. So I think there have been, anecdotally more extensive investigations when someone is slimmer and diagnosed with type 2 diabetes. But then the negative side, I think I've also heard from people that they feel that there actually haven't been the same treatment options for them, because although we do have many different treatment options for type 2 diabetes, most of the ways in which we manage type 2 diabetes is actually focused on weight loss and weight management. So if you don't need to lose weight, there are a lot fewer options, and health professionals generally, I think, are less well prepared for that.
Yes, because people are repeatedly asked to lose weight, even if they've struggled to do that in the past. So I never thought about someone thinner not having the same type of treatment in that way. That's interesting. If diabetes stigmas are a system issue, so a problem with our society and cultural problem, what responsibility should someone with type 2 diabetes expect of their medical professional, and as far as trying to reduce the stigmas?
what all people with diabetes, in fact, anyone with a health condition, can expect from their health professionals is for their health professionals not to contribute to that stigma, and not to stigmatize them in the way that they consider managing it. So, some examples of that is research that we've done with people with type 2 diabetes who've said that some health professionals don't look past their weight, and they assume that because they're overweight that they're not willing to, that they don't really take personal responsibility, that they're not really willing to, go the extra mile in terms of managing their condition. And so then they're not offered appropriate treatments and options, and they're not offered the support that they need from their health professionals. And I think that is a terrible indictment on health professionals generally, and I do appreciate that not all health professionals are like that, but we've heard this so many times, in particular in primary care, that I think that we definitely need to be doing more about this systemic issue, and health professionals need to be aware that this the experience of stigma is not trivial. Even if health professionals assume that there are not these impacts on people's willingness to take medications and therefore for their physical health, sometimes perhaps they assume that, well, it's just how people feel, and maybe they're taking on that stigma and self-stigmatizing, and that's an area of stigma that we didn't really talk about earlier, but people do self-stigmatize as well because they take on these messages that society has, or they indeed feel bad for something in their past and think that somehow it is their fault that they've ended up in this situation. But health professionals shouldn't minimize or underestimate the impact that stigma has on people's emotional and mental health, and the impact that all of that has overall on them and their ability to manage their condition well.
I have to ask, you mentioned self-stigma, and I've also noticed too, there's a lot of shame or blame even within the type 2 diabetes community. So someone might say, I have type 2 diabetes, but I don't use medicine, so I'm doing a better job than you. You have to use insulin, or who has to use medication. And so I think, or this diet is ideal, and some of those things. So do you think some of that is because there's such there's that gradual loss of insulin making cells in type 2 diabetes? So even though people have the same diagnosis, they have so many different treatment plans based on their resources, their medical care, and then on top of it, where they're at along that progression of diabetes. What's your take on kind of the inner battle between people who have type 2 diabetes and stigmatizing even within that community?
One of the as I've already said, one of the benefits that we have in type 2 diabetes is that there are many, many treatment options available. And a drawback is that it's not easy to identify who needs what. So I think, health professionals themselves find that challenging, particularly, general practitioners who need to be, generalists across a number of different medical conditions, not just diabetes. So the complexity of diabetes and all the different options available can be really challenging for health professionals. But I think what that means for people with diabetes is that there ends up being a lot of frustration about the way in which, those treatment options are presented, the extent or the time that it takes to find the right treatment for the right person. And so there can also be resentment that the clinicians, have stigmatized or haven't offered people the right treatment at the right time, and for whatever reason may be behind that. And so I think where when they do find the right treatments, there can be a lot of frustration and a lot of anger about why it wasn't identified or offered sooner, particularly if complications have indeed, started to arise in the meantime. these things do take many years sometimes, and I think that that's terrible for people with diabetes to live with. The idea that, if they'd found the right treatment sooner, they may not have got this particular complication, or experience their diabetes in that particular way. And so, of course, when they do finally find something that works well for them, they want to share that with everyone else, and they also want to share their anger or frustration about why that wasn't offered sooner. And I think that can be, it's incredibly, I think it's easy to understand why those frustrations and concerns arise. But I think it's also too easy to assume that just because this works for me, it now must work for everyone else. So I really do think that we all need to appreciate that, what works for one person may not work for another. What suits one person doesn't necessarily suit another.
What would you say to someone with type 2 diabetes who might feel overwhelmed by stigma, that maybe it's a hopeless endeavor to ever overcome the stigmas that are around them?
Yeah, look, it's incredibly challenging to live with stigma in your life, and we know that all sorts of people with all sorts of medical conditions, or because of their sex or the color of their skin or their religion, all sorts of people experience stigma. So we have a lot of understanding about what it takes to live with that and to cope with that. And I think the first thing to say about that is that you have to focus on yourself and not worry about the opinions of others. You certainly need to not allow the opinions of others to become your own opinions of yourself. So, not allowing that stigma about diabetes to turn into a self-stigma and a self-blame. So it's fine what other people think is their own concern, how other people deal with their own diabetes or think about diabetes is their own concern. So I think for a person who's experiencing that, it's important to just focus on being kind to oneself. Think about how you might talk to a really good friend who has a similar issue, and you'd probably find yourself being a lot kinder to that person than you would be to yourself. So focusing on self-compassion, and the things that are within your own control. You can't control necessarily how other people think of diabetes or think of you and your diabetes, but you can control how you manage your diabetes and what you do about it yourself and how you think about it yourself. And if you think about it as a condition that's incredibly challenging to manage and that you're just doing the best you can with what you have, then it will hopefully relieve some of that burden that may exist. In terms of, you mentioned that it's sort of a hopeless endeavour to feel that you can overcome these stigmas, and I think that may feel true to some people, but it's terribly depressing to think of things being hopeless. That does indeed lead to depression. So I think we do have to appreciate very much that the world is changing and quite rapidly. So although some things, stay the same and some things seem to, have been around a long time, and that certain feelings may feel like they've been around forever, I think we've seen just in the last few years, even in the last few months, how certain issues are really changing, and society is becoming, in many ways, much more understanding of the differences that bring us all together. We are all different. So as much as we are different, we're all the same. So I think now more than ever, we should have hope that things can change. And the fact that we've been doing research in this area and so many people like yourself are interested in this and broadcasting it to so many more people so that people can become more aware of the issue and of its effects. I think all of that has to be, to the benefit of everyone. it was just a few years ago where no one was talking about this. It existed, but no one mentioned it, and no one really appreciated the impact that it was having on people. So, we're talking about things a lot more openly now, and we still have a long way to go, but I think we're hopefully on the right path.
Yeah, because like you said, even 10 years ago, this kind of research didn't exist for diabetes. Do you have any wisdom for healthcare professionals listening who may have faced some backlash from colleagues in standing up for people with diabetes? So particularly, I'm kind of thinking about the weight stigma piece. Many people with type 2 diabetes, like you said, have that experience where if they are heavier, they their treatment plan is basically lose weight, no matter how you do it, lose weight. And so for some people, there's the health at every size approach, and there's some people who are weight neutral. And I would consider myself to be someone who is, I don't know if I like to use the word weight neutral, but weight inclusive. I want someone to focus on their health routines and habits and not necessarily fixate on body size, because I know those health routines are going to be impactful no matter what their body shape is. So sometimes you kind of get a little bit of backlash for that kind of stuff from colleagues. So what kind of wisdom do you have maybe for healthcare professionals that are trying to be a little bit of that trailblazer and help people with diabetes break down some of these stigmas?
I think those health professionals need to take heart from the fact that they will have much better relationships with most of the people that they see with diabetes, and that therapeutic relationship is so important for continuity of care, for trust. So people with diabetes, people with any health condition, if they don't trust their health professionals, they're less likely to follow their advice. They're less likely to take their medications as recommended. They're less likely to go back for checkups because they perceive that they may be, made to feel guilty, or their HbA1c isn't good enough, and that kind of language can be really detrimental for people in terms of feeling that it's important and okay to go and see their health professional. No one should be dreading to go to see their health professional for their routine checkups that they absolutely need in order to stay healthy and well for the rest of their lives. So I think, people do vote with their feet. They do decide that, well, that health professional isn't for me, or I'm not going to go and see them. So whether they stay registered with them and just never go and see them, or whether they move on to a different health professional, I think this comes out, this all comes out in the wash, that, the health professionals who are most understanding and supportive of the person's personal context, the challenges that they face, the resources that they do or don't have available to them, I think those health professionals will find that people with diabetes, do come back to them and that they have something to offer. So I think that, what advice do I have for health professionals who actually treat people with diabetes well? And I think carry on doing what you're doing because you're getting it right.
You're creating a safe space for them.
Yes, exactly. Yeah.
To get the healthcare they need. Yeah. I have kind of an envisioned question for you. If you could remove all of the stigmas around diabetes, what does that look like in your opinion? What would a world without diabetes stigmas look like?
Yeah. Well, it would be a world where people were far more accepting of people managing their condition in the best way that suits them. So people would no longer comment on what people are eating or what they're doing or not doing in terms of physical activity, injecting medications, monitoring. People just wouldn't comment. They would just accept that person is doing what they need to do to manage their condition. And that would make the world a much better place for people with diabetes, where they felt that they could just get on with things without having to hide what they're doing for fear of someone thinking that they're doing something wrong, or for someone thinking badly of them for for why they even need to be doing that in the first place. So I think that that's one thing. And indeed, people with all types of diabetes would be far more accepting of other people with all types of diabetes and the ways in which they manage their condition. So I think, it's horses for courses, and it would be great if there was just a lot more acceptance and understanding of the differences and the ways in which people need to do things, and that people are just doing the best they can with what they have available to them. But I also take a bigger picture approach than even that, and think that if we really didn't have stigma around diabetes, then we would actually be in a much better place for people with diabetes, because there would be more funding for treatments and support and research into diabetes. I do believe that diabetes doesn't get the funding that it needs, both in terms of the treatments that are available to people who need them, but also in terms of the research funding available. So when you look at the extent to which diabetes is funded compared to cardiovascular disease, cancer, dementia, it pales to insignificance, the amount of funding that diabetes attracts compared to those other conditions. And yet diabetes is, arguably equally challenging, and it's certainly, a pandemic in itself that needs serious and careful attention. And yet, we've heard from, politicians, in the US, just a couple of years ago, there was, a statement about the budget from, I think it's Mick Mulvaney, and he said that people, that we shouldn't be required to take care of a person who just sits at home and drinks sugary drinks and gets diabetes. But we do have...
Really?
Yeah, absolutely. But he also said that we have plenty of money to provide for, if you get cancer, so that you don't end up broke. And yet, actually, what we know about diabetes and cancer is that many of the same risk factors apply. So there's clearly a stigma being played out there that is detrimental to people with diabetes. So we absolutely need to be doing more to change the image of diabetes at a society level, at a politics level, to make sure that people get the funding, that the condition gets the funding that it needs, both in terms of research to find a cure, to find better treatments, for better support, but also to make sure that people get the treatments that they actually need to manage this condition as best they can.
Wow, and I think people don't realize that diabetes is a risk factor for a lot of those things that get big funding. So if we could get the funding for people with diabetes, we could potentially impact all of those things too, and the quality of life for people with diabetes. Yeah, that's very eye-opening, very eye-opening.
Yeah, absolutely.
Up next is Jane's takeaway of the day.
Takeaway of the day: turning your information into action.
Last question, takeaway of the day would be basically, of all the things that we talked about in diabetes, in your research, stigmas, what would be your biggest takeaway for people? Maybe, what's one step someone with type 2 diabetes could do to kind of combat stigmas for their own well-being, and same thing on the healthcare professional side, or in general, just what's your big takeaways from this conversation that you would want people to walk away with?
For people with diabetes, I think, don't let the stigma create self-doubt. Don't let it take hold and create that self-blame and that story in your head that says that it's all your own fault, because that's just a downward spiral. And don't isolate because of it. Don't think that it's just me. Everyone else, has a different thing going on, but this is me, and it's all my fault. So, don't isolate, join a peer support group, put yourself in connection with other people, and you'll soon find that other people have felt the same way, but other people also often increasingly are identifying ways to overcome that negative self-talk. So I think it's really important that people just don't let that take hold and find other people that they can chat with that can help them to overcome those feelings. And speak out about it. If you see it, call it out, because that's the only way in which these things change. For health professionals, I think I do just have one clear message, which is that our language matters. So I'm sure that you've come across the work that we've done, position statements around the language that we use in diabetes, and those position statements are becoming more common around the world. So there are now not only a position statement in Australia, but you have them in the US, they have it in the UK, there's one in India now, there's now one in Canada. Just very recently, the Canadians brought out their own position statements. So there is increasingly a recognition that the language and the words that we use in diabetes really do matter. And have an impact not only on people with diabetes, but on the way people in society view diabetes as a condition and view people with diabetes. So for all the reasons that I've just spoken about in the last however long we've been chatting, I think health professionals really do have to take their words very seriously. It's just as important in terms of keeping that person coming back to their consultations. That's one aspect that's incredibly important. So showing empathy, being an ally for that person, being a supporter. You're not that person's keeper or that person's minder. You're just there to support them in identifying the best treatments available to them and enabling them to take those treatments and keep well. So, it's important from that perspective, but it is also incredibly important that we change the image that diabetes has, that we show that diabetes is just another condition. It's just another challenging condition that people may have, and that we create a society in which people with diabetes feel supported. And
that's a wonderful takeaway for both. I think that both sides of the world of medicine will appreciate that, the people that come to seek care and the people that give care. So thank you so much, Jane, for taking the time out. What an honor and a pleasure to have you on, and I can't wait to share this with people with diabetes and the healthcare pros that listen.
Oh, thank you so much for inviting me. I've really enjoyed talking with you. I'm sorry that we have to talk about this particular issue, because I think it's very sad that it exists. But I'm really delighted to have been able to have this chat with you and get the message out there a bit more. Thank you.
A big thank you to Dr. Jane Speight for taking time out of her busy schedule to do this interview. And to all of you listening, I hope you enjoyed this interview as much as I did. Enjoy your next couple of weeks, and I will see you back here September 8th for the official start of Type 2 and You with Meg Season 2. And until then, don't forget, the number one thing you can do to manage your diabetes is bet on you.
Keep current on new episodes by subscribing to Type 2 and You with Meg. Be sure to share a link of today's episode to someone you know living with Type 2 diabetes. Want to learn more about today's topic or need answers to your diabetes dilemmas? Contact Megan by using the links in the podcast description or visiting her webpage, type2andyou.org. This podcast is for informational purposes only and not intended as medical advice.